Okay, this is not Halloween yet, but we're going to talk about Botox for the upper mid-face. Now, what I've outlined here in brown are the areas of the major muscle groups. When I do Botox, I want you to think about the three areas that we work on. One is the frontalis muscle, which is the forehead outline in this larger brown that you see. These two muscles here, this little gull wing type of seagull look, is called the corrugator muscles. And then there's a muscle that runs up and down called the procerus. And then there's muscles that wrap all around the eye, but we really work principally out here in the crow's feet. This muscle is called the orbicularis oculi. So what does all this mean? When you lift your forehead up, the muscles here create little horizontal lines. That's the frontalis muscle. So when we block this muscle up here, you have fewer wrinkles when you lift your brows up. The muscle here, the corrugator and procerus, you should think as one, this Y-shaped area as one unit. This combination of these two muscles pull down. The sides of the eyes, the orbicularis muscle, when you smile, they actually pull the brow down. So these two sets of muscles here and this set of muscle in the middle pull down, and the frontalis muscle is the only muscle that lifts upward. So why is this so important? Because besides knocking out the wrinkles across the forehead, the wrinkles when you frown and the wrinkles when you smile, every action has a reaction. And what we're talking about in this situation is actually that, let's say I block your forehead alone, and you have a very weak muscle to begin with, or your brows are slightly low. There is a chance that your brows could actually come down a bit, and that's very unlikely if you're younger, or if I look at your brow position and I say, you know what, the chances is probably less than 5%. And some people, if I don't go all the way out here, you get this weird Joker peak, which is not good. And some people, if I go too far out here, the brows can come down. That's part of the artistry of looking at a brow position and making a determination to do a safe injection. Obviously, if there's any concern that that could be a problem, you would either A, tell the patient that you would not inject that far out and see them back in 2 weeks to make sure it's okay, or two is understand that if this part is in fear of falling, you inject this area in tandem. Now let me explain what that means. Let's think of it like a tug of war. Let's say I inject the frontalis muscle, the only muscle that pulls up. So if I block the only muscle that pulls up, and that no longer pulls up, now I've got a set of muscles here and here that pull down. So that theoretically can actually drop the brows down afterwards. So you may need to inject these areas to bring them back up. So this is just balancing, to think about balancing. That's why I always see my patients back 2 weeks out after the first injection to make sure that everything is okay. Now, the contrary is people say, well, how do you get a Botox brow lift? I always talk about this brow lift. When I look on the sides here, this area right here, if I block this muscle, the pull down muscle, this muscle pulls down. If I block the pull down muscle, then the brow and the frontalis, if it's strong enough, will actually pull it up. So the way that a brow lift occurs is that if I block the pull down muscle, this is no longer in effect, this will pull up in most patients if it's done correctly. Also, if there's a little brow asymmetry, let's say this brow is a little lower than that one, I want this one to go up higher. I'll go higher into the tail of the brow to inject than this side so that I can create some symmetry. As you probably heard in my other video, symmetry is not so critical, but some people are bothered by it. If I can make some small adjustments, it's really nice. And then when we're looking at the corrugator muscle, I call this the Botox bra because it lifts and separates the center. When I inject this area, the brow will go up and out. Now, if you have a very strong forehead area, it's going to drop down a little bit if I don't inject this potentially. So there's two things I want you to think about when I'm looking at Botox in terms of the effect that I'm trying to achieve on the short end. One is wrinkle improvement, okay? And that's going to be the obvious thing that people do Botox for. But the other thing is brow positioning. So every action has a reaction. As I said, if I just inject down low, then this will pull up. If I just inject here, this will pull down. And so that's the part of the art of Botox, is getting a good balance. So I just wanted to explain some of the musculature and things that go beyond just wrinkle effacement, but also talking about brow and eyelid position based on how you can actually use Botox for some contouring of the upper mid-face.